Welcome to Wellness by Mommy. I hope you are safe and sound. In today's video, let's talk about breast lumps. Let's take a look at the different types of breast lumps and how they might appear. While this can help a person understand if a lump is likely to be cancerous, you should always seek advice for an unexplained breast lump. Some non-cancerous lumps need treatment, and breast cancer does not appear in the same way for everyone. A breast lump is a localized swelling, protuberance, bulge, or bump in the breast that feels different from the breast tissue around it, or the breast tissue in the same area of the other breast. There are different reasons why breast lumps develop. Causes include infection, trauma, fibroadenoma, cyst, fat necrosis, or fibrocystic breasts. Breast lumps may develop in both males and females but are more common in females. Some lumps are cancerous, but most are not. Causes. The female breast consists of different types of tissue. The two main types are milk glands, which produce milk, and milk ducts, or tubes, for milk to pass through to reach the nipple. The breast also contains fibrous connective tissue, fatty tissue, nerves, blood vessels, and lymph nodes. Breast tissue composition can vary depending on the function. For example, during breastfeeding, the breasts will change. They will feel and look different. The breasts can also change throughout the monthly cycle. Each part of the breast can react in different ways to changes in body chemistry. These changes impact the sensations and texture of the breast, affecting the development of breast lumps. Possible causes of breast lumps include cysts, abscesses, which can indicate an infection, such as mastitis, fibroadenoma, intraductal papillomas, fat necrosis, lipoma, breast cancer, gynecomastia. In males, when there is swelling in breast tissue, some breast lumps seem to have a distinct border, while others may feel like a general area of thickened tissue. Nipple discharge can occur with some lumps. Types and symptoms. Breast lumps can develop for many reasons, cancerous and non-cancerous. The symptoms may vary depending on the cause of the lump. For non-cancerous lumps, the size, feel, and texture of breast lumps can vary considerably. The consistency may help a physician diagnose what kind of a lump it is. Breast cysts. A breast cyst is a benign or non-cancerous fluid-filled sac in the breast. They commonly affect females aged 30 to 50 years, and are rare after menopause. It may cause no symptoms, or a person may notice a smooth and rubbery lump under the skin, pain, nipple discharge. It is not clear what causes breast cysts, but they may develop in response to hormones related to menstruation. Cysts can be simple or complex. In both cases, a doctor may suggest removing it by aspiration, a type of surgery. Very rarely, a cyst with solid components that returns after aspiration is linked to underlying breast cancer. Abscesses. Abscesses sometimes develop in the breast, especially during breastfeeding. They are non-cancerous and usually result from a bacterial infection, such as mastitis. A person may notice a lump or mass, pain and swelling, redness in nearby skin if the skin is pale, or a darkening of darker skin, heat in the area around the abscess, discharge from the nipple, nausea and vomiting, fever, swollen lymph glands. Treatment will usually involve draining the abscess, taking antibiotics, using nonsteroidal anti-inflammatory drugs, NSAIDs, such as ibuprofen, to manage pain and inflammation. If a breast abscess occurs when a person is not breastfeeding, the doctor may do tests to rule out breast cancer. Cancerous lumps. A breast cancer lump or tumor can appear in the breast or underarm. Warning signs include a lump, thickening, or swelling of the breast, skin irritation or dimpling, flaky skin on the breast or around the nipple that may be red or darker than the surrounding skin, nipple pain, nipple inversion, or pulling inward of the nipple, discharge, which may contain blood, Changes in the size or shape of the breast. Pain anywhere in the breast, although there is often no pain. Some people do not notice any symptoms, but following a doctor's recommendations about screening can help identify breast cancer if it arises. The symptoms of breast cancer can resemble those of other breast lumps. It is a good idea to seek medical advice if any breast changes occur. Checking for lumps. The American Cancer Society does not recommend self-examination as part of the screening process for breast cancer. However, it is essential to be aware of the breasts and any changes that take place. The display infographic shows 5 steps for breast self-examination. It is important to be familiar with the breasts. Knowing how the breasts normally feel can help one recognize any problematic changes or lumps. The following guidelines will help one carry out a self-examination. Step 1: Looking in a mirror, check the size, shape, and color and look for visible swellings or lumps. Step 2: Raise the arms and repeat Step 1. Step 3: Check for any discharge from the nipples that may be watery, milky, yellow, or with blood. Step 4: Feel the breasts with a firm, smooth motion while lying down, including under the arms and down to the rib cage. Step 5: Repeat Step 4 while standing or sitting. It may be easier in the shower. Even though most breast lumps are benign, a person should ask a doctor if they notice anything unusual. I hope you find this helpful. Please subscribe for more interesting, evidence-based, educative and informative videos. Like and share this video. Turn on your notification icon so you can be notified when next I drop a new video. I desire for you good health and long life. See you in my next video. Till then, stay safe and remain healthy. Peace.